Second prof tells you the pathology, what happens when something is abnormal is just a deviation from normal. The first and the foremost thing is don't bunk. Do not replace books with classes. Books are gold. If you want to build anything amazing, be it a very, very big building like Burj Khalifa, or be it a strong cricket team like us, or build a beautiful monument like Taj Mahal, or make an amazing medical career like you're going to have in the future, you need a very strong basic foundation. And the foundation for your medical career is nothing but the second prof. If you're first time here, I'm Dr. Ranjith, your pathology faculty at PW Med. If you've not clicked the subscribe button yet, it's a time to click it. Subscribe to the channel and let's discuss more about pathology and medicine life as a whole. And this 6 to 7 minute video is for all the second prof students who's entered the second prof, maybe after getting a distinction or honors in first year or struggling the last 2-3 months with foray and clearing it. It's a time to redeem yourselves. It's a time to make the tables change. And it's a time, maybe next time you will get distinction and honors in all the 3 subjects. And if you're ready for the game, listen till the end of the video. And if you have any doubts, put in the comment section. I'll be more than happy to answer your queries. So the foundation is very, very important. Why did I say that second prof is foundation? Because in first year, what you learned is the normal muscle, how the cell functions and how the cycle works, right? Anat, physio and biochem. But I'm not going to see normal people in the hospital. We are going to see abnormality. Second prof tells you the pathology, what happens when something is abnormal is just a deviation from normal. What organism will cause it if it's an infection? Microbiology. And how to treat, what is the basic mechanism of the drug in pharmacology. So what you're going to do is apply all these things in your real life and treat the patients. That's it, very simple. That's why it's a very important bridging gap and you have to ace second prof at any chance. So that you can become an amazing doctor, not just that, obviously ace your entrance exams as well, right? Now, let's divide your second prof in as per your college does, right? In your second prof, the most difficult thing is there are 2 things to juggle. One is your clinics, which your seniors might say, no, leave it, it's okay, we'll see it later. Never do that. That's one of the important don'ts to do. And also the college, which is going to cover everything in the next 10 months and going to give you an examination at the end of 11-12 months. It's difficult, but it's not impossible. It's difficult, but at the same time, it's very, very interesting. It's difficult, but there are seniors who have done that and you're aced. So we're going to follow them. That's it. As simple as that. So what exactly do during clinicals? Because first half of your posting is going to be clinicals. The first and the foremost thing is don't bunk. You should not do that. Doesn't mean that there's no attendance. Doesn't mean that there's no end of posting exam. Doesn't give you the right to bunk. Because the exams for this second year clinicals will happen 10 years down the road when you sit in the front of patients. Because this is the only time where you can focus on 2 basic things, that is history taking and basic examinations. Trust me, you will never get a better time. Don't need to go and diagnose now. No need to go and diagnose rough rumbling, mid-diastolic murmur, pansystolic accentuation now. That is not the goal of second prof clinicals. Is to learn how to talk. Because unfortunately, as a generation, we are depending on AI and you're losing the ability to make a conversation. And this helps that. Building a rapport without stress. Because no one is going to ask you if you make a wrong diagnosis or you don't find a correct finding. Talk with the patients. Talk with a person who's having ailment, how to comfort them, how to get the valuable information from them via history taking. This solves 90% of the problems which you see in the future. And the next, obviously, basic examination. What is percussion? What is auscultation? How do I do? What is the procedure to palpate? Right? So these are the things which is required. Obviously, you might have seniors, you must have your college professor teach you. If you feel that I'm not having enough guidance, PW Med has a clinical corner. The goal of clinical corner is very, very simple. It's free for everyone. It's for you to build your career, that's all. That's a goal. You will have all the important cases for MBBS, what to learn, what to see, what history to ask for, and what examination to find. Everything required in clinical corner. You just have only one thing to do, and that is read it, that's all. Open the app, click on it, read it, apply, read it. That's enough. And in second prof, never ever miss this. If you miss this time, when you go to third year, you will feel like, only 2 subjects. Now let's relax. Or you might be required to write, okay, ENT ophthalmology is there, I'll rush that. And when you go to final year, trust me, you will not have time to go and build a rapport, learn from history taking, because that time you will be bombarded to answer viva. End of postings will be there. Lots of things will be there. This is the right time. Please don't miss this for an extra snooze and a sleep. So what do I do in a college? Second half is college, because first half you might think it'll be exhausting. It's not exhausting. It's just a conversation with the patient. It should be happy and cheerful. Once you've done that, go to second prof. So what I'm going to do in the colleges, and college we'll have our classes as well. Nishchay batch will take care of the entire CBME curriculum for you in the way it has to be taught, right? So in the college, that's a theoretical part. We have three major subjects. I'll be more talking about pathology because I have more authority on that than pharmacology and microbiology. Siraj sir and Anusha ma'am will take care of that for sure, right? So what to do for pathology? We can obviously do that same for micro and pharmacology as well. The first thing is, do not replace books with classes. Books are gold. Classes okay, but books are gold. So why classes is required? Classes will help you to reach the gold, because books is a treasure, and we are treasure hunters is going to help you to get the treasure. So use the classes alongside with the books to learn it. So listen to your lectures in the college. Might be boring, might not be good, but still listen. Passively you will get something into it, right? So that then when you come the evening in the Nishchay batch, your classes will be easier. You'll be able to understand better. So what we do in the Nishchay batch generally is, it's a very superbly crafted one. We'll have live classes from 6:30 to 8:30, 2 hours every day. And please, 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 I beg you, attend the live class live, not live recorded, for at least for the first 2 months. The reason why I'm saying this is it'll form a habit. Once you have the habit, you'll ask questions. You might be passive in the live lecture, but still someone will ask you questions. You learn. You learn by asking why, how, when, what. Might be your questions, might be your friends' questions, but please attend it live. That's very, very important. That's a USP of live batch, no? Why to watch it live recorded? Come live, attend, ask us question. That's our job to answer you guys, right? Then the most important is DPP. So this is must. I'll tell you why it is must for two reasons. You understand the concepts of pathology, pharmacology, microbiology in the live batch and apply here theoretically. This is the first step of application. It's a theory, so you won't have an error. And the second step of application is the practical in clinics. Revision. Because we read pathology, we read about MI. You see a patient of MI in the clinics, sorted. We read about gastric cancer. We read about the pathology. Apply that in the DPP, in the scenario-based question. Go and apply in the clinic, sorted. That is the bridge. That's why the first reason DPP is very important. It's not just for your scores. No one cares about the scores. It's the application of the knowledge that is very, very important, right? That's the first use case. Second use case is, obviously you'll have MCQs in your university exams. We'll take care of that. And slowly, we'll increase the severity so that you will also be very well prepared for your NEET, PG and IST from now itself. That's it. It's a very compact day and I want you guys to use the best of it. You are with us, you have your time. Please don't say you don't have time. You have abundance of time. Use that properly, use that usefully. Just what I want is attend your lecture in the morning, come to complete your college, come back by 5, be with us for 2 hours. After 9, sleep, play, browse, do whatever you want. But till that, give it to us and we'll make sure your time will be much valid and will be returned in the way you can never imagine. That's all from me. That's all in the video. Again, like I said in the start, if you have any doubts, put in the comment section. I'll be more than happy to answer your queries. And I am very excited to start Nishchay Batch 2025 and I hope you as well, right? See you soon. Thank you. Bye-bye.